Hi, my name is Arla Meyer, and I'm going to talk to you about Medicare, and in particular this time I'm going to talk about what will Medicare cost. This is a Medicare card. It has the name, Medicare ID number, which is a Social Security number plus a letter, and it has an effective date for Part A and for Part B. In this case, it's July 1, 1986. So original Medicare has two parts, Part A and Part B. So what will that cost? For most people, Medicare Part A doesn't cost anything because you've already paid for it. You've paid for it in your wages. So the Medicare Part A premium is usually $0. Medicare Part B is, for most people, $104.90 a month. These two together constitute original Medicare. It says right on the card, Part A is for hospital, and Part B, they call that medical. So Part A, hospital, Part B, medical, which means doctors, labs, emergency rooms, ambulance, outpatient procedures of any kind. And Part A is mostly hospital, plus a few other little things, like hospice and short-term care. So, $0 and $104.90. Now, if you have higher income, if you are married and together have an income of greater than $170,000, this will be higher. And if you have quite low income, sometimes you can get help with this premium. And I can talk to you about that another time. But for now, let's assume Medicare Part A and Part B together, original Medicare, costs $104.90 a month. Now, in addition to that, frequently people will buy Medicare Supplement. Let's talk about that cost and why they would buy it. Medicare Part A, in the hospital, if you were to admit it to the hospital, you would have to pay the Part A deductible, which is $1,216. And after that, Medicare Part A would take care of the rest for that visit. Medicare Part B has a small annual deductible, $147. After that, Medicare Part B, for doctors and so on, pays 80%, leaving you to pay 20%. They call that the Part B coinsurance. So traditionally, when what we had was original Medicare, people would buy Medicare Supplement, also known as Medigap, because it fills these gaps that we talked about. 20% Part B after you've met this deductible, and this Part A deductible. So Medicare Supplement is the same as Medigap, which you've maybe heard of. So Medicare Supplement plans were standardized and given letters A through N. And standardized means each letter must pay exactly like the government says. The most popular plan is Plan F. The reason it's the most popular plan is that it pays all these things. So between Plan F and your original Medicare, you won't have to pay anything to see the doctor, go to the emergency room, get labs, go to the hospital, anything that's a medically necessary procedure that Medicare approves. So what does a Plan F cost? Depends on your sex and where you live and if you smoke. Somewhere between $100 and $200. Depends. Between a Medicare Supplement Plan F, original Medicare, the only thing you would have to pay for would be co-pays for your medicines, and that would require another part. Instead of Part A, Part B would be Part D for drugs plan, which we will talk about at another time. So you don't have to get a Plan F. In fact, you don't have to get a Medicare Supplement. There are another kind of plan called Medicare Advantage, which after you've gotten your original Medicare, you can trade that in for a Medicare Advantage plan. And we should talk about all of your needs and what fits you best. My name is Arla Meyer. There's my toll-free number, 866-923-4610. please give me a call. Thank you. Hi, my name is Arla Meyer, and I'm today going to talk to you about Medicare, and the topic is, should I apply for Medicare? And if so, how do I do it? Here's a Medicare card. Shows name, Part A effective date, Part B effective date, and that's what a Medicare card looks like. As it points out, there are two parts, A and B. And why wouldn't somebody apply when they're first eligible? It's because Medicare costs something. Part A generally costs nothing. You've already paid for it. Part B generally costs $104.90 a month. And in addition to that, you'll probably get something like a Part D plan for drugs, which costs at least $12.60 a month and goes up from there. So most people, when they're first eligible for Medicare, get Medicare because it's great insurance and the price is right and you get good coverage. However, not everybody's eligible, of course, and not everybody wants coverage when they're first eligible. So let's talk about what makes somebody eligible. The two most common ways of becoming eligible for Medicare are to turn 65 and also if you've been disabled for 24 months and have received a Social Security check. In those two cases, you may or may not be automatically enrolled. If you've gotten your Social Security check for 24 months, you should get your Medicare card in the mail. When you get it, put it in your wallet, and we can talk about if you want to add something to your Medicare or not. When you first turn 65, if you're getting your Social Security check or plan to, then you should also get your card in the mail a few months prior. They say 3 months prior to your 65th birthday. If you're not going to get your Social Security check but you're waiting, then you must call or apply online or go into the office and apply. So let's talk about those three methods. The easiest method to apply, in my opinion, is to go onto Medicare.gov website. And right on the first page, you'll see a big button that says Apply for Medicare. When you go onto that button, it redirects you to the Social Security website where you apply for Medicare. And of course, you'll need your Social Security number to make the application. Sometimes you're going to want to speak to a real person because your situation is a little bit complicated. Well, then give Social Security a call. 800-772-1213 is their toll-free number. And finally, you may need to go in to the Social Security office because your situation may be a little complicated. What could be complicated? Well, let's say when you first turned 65, you had good insurance through your employer and didn't want to enroll in Medicare and pay the Part B premium and Part D premium. So you kept your original, you kept your employer's insurance. During that time, many people will enroll in Part A because it's free usually. So when they first turn 65, generally, it's still a nice idea to enroll in Medicare, but don't enroll in Part B yet. Other complications would be moving and so on. But if you are one that's delaying your Medicare because you have good employer-based plan, when it's time that you want your Medicare Part B, then you should definitely go into a Social Security office because you're going to have to give them some documentation that proves that you've had creditable coverage. Creditable coverage means insurance that's as good as Medicare includes a drug plan, and your employer will know how to give you that documentation and prove that to Social Security. If you don't enroll when you're first eligible for Medicare and you didn't have creditable coverage, things get really messy. They will penalize you, and then when it's time you want to enroll in Medicare, they make you wait till January of the next year, and then when you enroll, it won't be effective until the middle of that year, and you always will have a penalty. So it's good to relate to it. Enroll when you're first eligible, unless you're putting it off because you know you have creditable coverage. My name is Arla Meyer. I help people with their Medicare. My toll-free number is 866-923-4610, and my website is freemedicarefax.com. Thank you.